All right, everybody, welcome to my session. Started from the bottom, now we're here. If you can't tell, I really enjoy puns. You'll see that throughout the session. But today we're just going to talk about advocacy and just the basics that you can do in everyday life. So there we go. So background about me, I currently work in a long-term care / short-term rehabilitation facility. At times, I've been the only CTRS in the department. Many of the examples that you see come from personal experiences or personal projects that I've worked on, and we're going to discuss, as well as I do it personally, advocating both in your personal and your professional life. So hopefully at the end of the session, you'll be able to describe ways to advocate professionally and personally. If you cannot already, describe the difference between activities and recreation therapy, and define 3 ways to network with professionals. So to get started, here are some different types of advocacy: case advocacy, self-advocacy, and you can see the list goes on. But today we're specifically going to discuss internal advocacy, which is done by those employed by an agency in order to alter the policies or practices, and obviously professional advocacy, advocating for the profession. So, why is there a need for advocacy? I'm getting some feedback. All right, so why is there a need for advocacy? Well, we're an ever-growing field. We continue to grow, and we continue to need to advocate for our profession. Obviously, with COVID-19, a lot of what we do kind of looks different, but we've been wearing a lot of hats. We're creative. So at times we have been residents' family members, or just keeping them engaged and keeping their mind at ease. So we've definitely been doing a lot in that department. We continue to distinguish ourselves from other disciplines. We're not just part of the bundle, we're an essential part of the team, and we need to advocate for that. And our education, we went to school for 4 years, depending on what way you took. We did our internships, and we took the certification exam. So we worked hard for those letters. So we need to show them proudly, and we'll discuss different ways we can do this. And we're our own marketing team. If we don't advocate for ourselves, who's going to advocate for us? All right, so different ways we can advocate professionally and personally. So first of all, professionally in your organization. So like I just discussed about your letters. So just as an example, on my badge here, I know it's got all my stickers from being tested, but I put my little pin here with CTRS. When I first started, I only had my name, and I said, you know what? I earned those 4 letters just like the RNs and the LPNs. So I asked HR if they could put my letters on there. So it sparks a conversation signs for the department. So depending on if you have an office, if you have a section of your facility, maybe putting recreation department, director, your title on the door so people know who they're coming to speak to. And so in your organization, discussing with administrators or higher ups why recreation therapy is important. This is also important between disciplines. Obviously, depending on where you work with different disciplines. In long-term care, we work with a number of different disciplines, including OT, PT, speech, nutrition, and the list goes on. So different ways we can advocate with them is possibly co-treating or advocating what we do as a profession. We're creative, different things like that. And obviously networking with professionals. Here we are at the conference virtually. We can network that way, but we will discuss throughout how we can advocate professionally. And in your personal life, simply just discussing with your friends and family what recreation therapy is. I know for me, I don't know about everybody else, when you first told your family, you know what, I'm going to school for recreation therapy, and they're like, huh? What the heck is that? And just explaining to them, we're helping people have the best quality of life that they can by doing things that they want. So it's, but I think my family finally understands what the heck I do. Social networking, also personally. I lost my train of thought. That's okay. Personal leisure interests and groups. We're not always the best recreators as recreation therapists, but maybe groups that you're involved in, such as like book club, maybe a sporting event that you're involved in, just maybe educating them on, hey, this might be a cool thing that I could utilize at work. Maybe one of my clients would really enjoy this because they like basketball or they like golf or anything like that. So just different ways you can interact personally and professionally to advocate for recreation therapy. So as I said, my background is in long-term care, and one of the big things in the couple years that I've worked is differentiating between activities and recreation therapy. Disclaimer, there is a need for both, but there might be a culture change needed in people's facilities to kind of advocate for the need for recreation therapy and for liability reasons having the qualified provider. So as you can see here, activities are more to entertain, divert attention. It can be led by a number of staff, both trained and untrained. And usually when you think of activities, it's a large group. Some people can be interacting, some people can just be sitting there. This can be with peers and staff, where us as recreation therapists, this is specific, this is goal-oriented. We have a care plan for everybody. It's individualized, and we require active engagement from the participant to measure how they're doing or if they're reaching their goals. So, and for the most part, we try to keep it done in small groups or one-on-one interactions. So I stated this might need a culture change because we want to hire the qualified provider. I've heard horror stories in the past, people just utilizing recreation therapist as a term of their job title, but they're not qualified, and then something happens because they weren't educated in the background. So maybe they don't know the different types of disabilities. Maybe they don't know, well, I didn't know the care plan. They don't know backgrounds of why things are individualized for a specific person. So it brings up the discussion, do we need to have both in the same department? Do we need to split the department? At times, specifically in my facility, there's only been one CTRS to do documentation and assessments for the whole building. So that can be difficult at times in aspects of certification, but also groups versus one-on-ones. Maybe if you had individuals in your department that aren't certified but have experience, maybe they can prepare the programs or they can do the big group programs and work on the entertainment, while the recreation therapist works on the assessments and works on the one-on-one interaction that could be individualized. Okay, so in order to advocate, we have to start with the basics. So I'm going to try to get in the comments here. When somebody asks you, what is recreation therapy? What is your go-to line? I can get a couple in the comments. Just tell me what you say. It can be short. It can be whatever you feel. And then I'll give you mine. I put the fun and functional. Love that. Use people's interests to help them play for their medical benefit. Oh, that's good. Recreation therapy. Provide programs to help people have fun and increase their leisure awareness. Love that. Using recreation to enhance quality of life and improve ability and skill. Love that. Thank you, guys. So my go-to, especially in long-term care, is the non-pharmaceutical holistic way of treatment, utilizing somebody's leisure interests, especially in long-term care. At times we look at all of the medicine that residents are on, especially in like the dementia unit. We try to limit that and try to engage them with things that they are interested in, and this can help decrease the amount of medicine that they are on, and it can decrease the amount of falls because of the meds that they are on. So I try to emphasize that we are we're not just keeping people busy. There's actually a background to us. So thank you guys for participating. Also, when you give people your spiel about what recreation therapy is, how can it benefit me? I put this question. So lots of times, like family members or the resident themselves, they say, well, what is this going to do for me? So just reminding them that we're helping you feel better or keep your quality of life based on things you like to do. I'm not going to force you to do things you don't want to do. We're here to have a good time, but we're also here to work on your goals to make you feel better by doing stuff you like to do. All right, some appropriate times to advocate. Obviously, co-treating with other disciplines, helping them and the client understand what recreation therapy is. During family meetings, again, not sure about everybody else's abilities, but during initial meetings or annually, we will have the family come in. Obviously, during COVID, we're doing conference calls, discussing with the family what recreation therapy is, how their loved one is participating, maybe if their loved one has some language barriers or verbal barriers, maybe just inquiring with them what their leisure interests are, what they did in the past, what they might like to do now based on their ability. And then other meetings as Q&A, which is quality assurance, falls meetings. We actually, not too long ago, this was really exciting. We had a doctor bring in a article about recreation therapy and how it can decrease the number of falls in a long-term care facility. So just right there, we had a doctor advocate for recreation therapy because they knew that there was a need for it. So that was kind of cool. What else do I have here? Remember to introduce yourself or continue to reintroduce yourself. I've had coworkers introduce me as the entertainer or the fun one. And although I am the fun one, I do more than just entertain. I'm a recreation therapist and I work on goals and I help the individual feel better utilizing what they like to do. Also, if you can't tell, it's all about approach. I've learned over the years that if you come off aggressive, you're probably going to get aggressive back. So maybe when somebody says, oh, here comes the fun one. What are we doing today? How are you entertaining them today? Say, well, yes, the recreation therapist is here and we are working on goals to do da 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 da. Will they understand the first time? No. But repetition helps, and simply educating others will help us advocate for what recreation therapy is. As one of my professors says, you only know what you know until you know something different. So let's get into the fun stuff. Now I'm going to discuss some of the ways that my coworkers and I have advocated for RT in the facility. And one of our big ways to advocate is Recreation Therapy Month. So let's see, I've got some pamphlets here I'm going to show you. So Recreation Therapy Month, for those of you that do not know, is in February. And at my facility, we've done it the last 3 years since I started. Each year we've gradually gotten better. So the first year we put up flyers, and I'll show you right here. Cold hands, sweet hearts. I told you we like puns and the whole RT. And we just put up flyers all around the facility. We have those monitors, so we put those there. We announced over the loudspeaker, hey, come down for, to understand what recreation therapy is. So we had an expo table. We had a trifold of information about what recreation therapy is. And basically, my coworkers and I brought up our college textbooks, and we kind of just discussed with staff members that came to see us what recreation therapy is. It was kind of back and forth. Did we get many participants? No, but we got a little bit of our word out there, and we got the question of why are you guys advocating? Why do I need to know what you do? Well, because we're recreation therapists, not activities. We're trying to utilize that culture change to help others understand what we do. So the second year, we started learning a little bit more. We probably thought maybe a little bribery or a treat would get people involved. So we did popcorn. I was proud of this one. Find out what's popping in the RT department. Again, we had these flyers all over. We discussed on the monitors. We put it over the loudspeaker. And you probably can't read that, and it's backwards, but it says, you better believe it will be a good time. So for this day, we had a popcorn machine, obviously. We gave out popcorn. This time we brought up leisure materials that we utilized with the residents, something from each domain, so sensory, spiritual, the whole 9 yards. We also brought up the trifold pen. But this time we put on pictures of past programming that we have done with residents. So they had an opportunity to see things that we have already done with participants. So that was kind of cool. And I believe that year we had a raffle too. So it got people involved to come down with a treat and a raffle. So that was a good time. And then our last this February, I believe, actually. Change the screen here. Our last one, we did an ice cream social. Sweet hearts with sweet treats. Come get the inside scoop with recreation therapy. So this time, we did the whole 9 yards. We did resident participation. So each day we had it Move It Monday, Together Tuesday, Worship Wednesday, Thinking Thursday, and Feel It Friday. We did all of the domains. We explained to the residents, what recreation therapy is. We also had independent packets all about recreation therapy, from word puzzles to coloring to you name it. So we made sure residents were involved and understood the advocating for recreation therapy. We split, as you can see at the top, like physical and sensory, we split each domain up into an ice cream scoop or a topping. So staff members had to come through the whole section of the domains in order to have their whole Sunday. So that was really cool because it interacted staff members, and you got an ice cream Sunday out of it. So that was my favorite so far because it really involved staff members, and who doesn't like a nice ice cream Sunday. Another thing that we also did, just to touch, because February is Valentine's Day, the one day, I think Valentine's Day happened to be on Friday that year, we had boxes of chocolate for each department, and we put a little pamphlet on there about what recreation therapy is. So just a couple ways to advocate. All right, another way we advocated. Disclaimer, it's not always good to show people that you can utilize materials on a small budget, because then you won't get another budget the next year, or they'll decrease it. So I'm just throwing that out there. But we're very thankful that the facility lent us an old med cart for the recreation department. And it took us a while to kind of decide on what to do with the med cart. But like I stated before, this is a long-term care facility and short-term rehab. So at times, especially on the rehab unit, we have less needs of care, or it's short-term, so they're not going to be here for long. And their abilities are usually higher than those on the long-term care unit. So we were finding that many people on the rehab unit preferred independent leisure versus group leisure in the long-term care side. So at times, our offices are down here in the dungeon and rehab is way over here. So we would find when we were doing their initial assessment, they would like books, word puzzles, independent stuff. And we were running constantly back and forth. And by the time you got back to their room, either speech was taking them, it was time for lunch, therapy's working with them, nursing's doing a treatment. It just wasn't working. So when they gave us this cart, which I actually have it behind me, I'm going to show you some stuff. I turned it into an independent leisure cart. We have all the sensory on it. Obviously, with there being small drawers, it has to be smaller materials. But this way, whoever the rec therapist is, whoever the facilitator is, can take the whole cart over to rehab. They have so many choices. This promotes independence, both for the resident, and it promotes choice. So instead of always going by the calendar or always going by what you have directly in your hands, this way you have access to a ton of different materials. So let me show you kind of what we're working with here. If you can see it, let me move it down a little bit. Okay, so I put signs on both sides that say independent leisure cart. At first, when we brought these over, they're like, "Are you giving me more pills?" And we're like, "No, we're recreation therapists, not nurses." So it's been a struggle. And obviously, with COVID-19, we haven't really had the opportunity to use this much with sharing of materials and all that, but hopefully in the future we'd get to utilize it. So if you open this here, trying to get it in the screen. So as you can see, here we go. Cognitive, sensory, social, creative, physical, spiritual. If you look, we've got like cognitive cards, lotions for hand massages. We've got rosary beads, social cards, paint, stickers, tennis balls, a little bit of everything. Ooh, colored scarves. And then there's also, you probably can't see too well, a larger drawer down here for extra equipment. I have like lights for sensory. We have adaptive equipment like card holders. That's cool. We have different space around there. Close this. All right, and then on the side where Sharp's materials usually go, we've got word puzzles, and we also have like wandering bags, individuals on their walkers or their wheelchairs. And on top, just some more equipment. I took Jenga, some boxes. We've got tons of yarn, different equipment. So utilizing that to the best of our abilities over on rehab, and also sparks a conversation, because if residents or staff members see another med cart coming, but it's not like the others, sparks a conversation. So another way to advocate. All right, that moves us on to COVID-19 and technology. So as recreation therapists, throughout this whole pandemic, we've been improving access to services. Some of us have had the opportunity to do telemed. Kind of funny, one of the books that I utilized for this presentation, it was from 2014. There's a quote in there that says, "Technology is changing the way therapeutic recreation services are designed, implemented, and evaluated." And I think in 2014, they were thinking, electronic medical records, being able to document online. Who would have thought in 2020 we're doing interventions and we're doing conferences virtually? Who would have thought? Throughout this process, we've been a resource, family interaction, important life events. My facility currently is doing FaceTime calls, Zoom calls, window visits. We have not opened up again for indoor visits yet, but hopefully soon. And throughout this process, had to educate ourselves on technology. I haven't really done Zoom before this, and thankfully I was never a student during this whole thing, so I've slowly learned how to do that. Learning how to do Skype, learning how to do FaceTimes, teaching other staff members how to use this for telemed. Some of our residents weren't able to go out, so they had to do their doctor's appointments via iPad. Teaching family members who are also in their 80s and 90s and 100s outside of the facility, or even their grandchildren, teaching them how to utilize this, teaching them how to download the apps, do all of that fun stuff. We've been a resource for residents. We've celebrated birthday parties virtually. We've celebrated anniversaries virtually. And then, unfortunately, I can vouch for this. I've had to do last rites spiritually for residents via iPad, as well as have residents attend funerals for their loved one via iPad. So although it has been a blessing and we're so happy that people still got to participate in that, it also just makes you stop and wonder, like, wow, technology, we love it, but where's it going to go from here with everything going on? So how can we use technology as a way to advocate? Well, we can use it as a modality for interventions. So utilizing an iPad, maybe we're working on fine motor skills or decision-making skills, so you can do puzzles, or our older adults love bingo on the iPad. There's different drawing materials. Also for language barriers, there's also apps to help with language. So sharing the importance of why these programs are so important, and showing our administrators, showing other staff why it's important to interact with our residents and keep them engaged. And also throughout this process, RTs have seen the challenge with navigating the complexity of COVID while working with individuals with dementia. At times, we're the only consistent thing they see, engaging them, keeping them active, keeping their mind active, and providing comfort, because at this point, we're their family members. We see them every day. We help with feeding, we help with comfort. So just showing others like RT is important because we've done this, this, and this throughout this whole process. It also could possibly provide reliable information to your facility and show them the need for technology, whether it's iPads, laptops, desktops, as a resource to help residents interact with their loved ones, but also as a safe way. It can easily be disinfected to interact with the residents. All right, so along with technology is social media and networking. So just a little tidbit, I guess. I personally have an advocacy Instagram. The handle is at rec.and.roll. There's my little picture down there that I made. On this Instagram, advocate for self-care and recreation therapy. Try to get the name out there. Try to help others understand what recreation therapy is, and especially with this pandemic and the high level of burnout, I try to advocate for self-care and the need for that. Utilizing social media helps us move forward in real time. We don't always have to, reread the textbook or wait for somebody to do research, although that is really needed. We can advocate in real time. People of all walks of life can see these things and question about, well, what is recreation therapy? How can I get involved? Or things like that. And it helps us keep us up to date with the news, what's going on in the world, what younger people are doing, what older people are doing, and what the needs are. Also, if anybody's interested, or if you were unaware before, utilizing the algorithms on different types of social media. So hashtags, for those of you that aren't aware, that's the number symbol or the one that looks like this. If you do hashtag and whatever group you're trying to reach, such as, for example, I'll do a picture of maybe a craft I did and explain underneath in the description what we worked on, what types of people I worked with, and why this is a good resource or why somebody else might want to use this. So underneath my description, I would do hashtag CTRS, hashtag recreation therapy, hashtag whatever. So that's one way to utilize the algorithm. I'll get to your guys' comments in a minute before I lose my train of thought. And time of posting. I don't know if anybody knew this, but depending on what time of day you post, obviously with time change and all that stuff, that comes into play. But depending on what time you post, you might get engagement based on who's awake or who's looking at this type of stuff. So I found that morning, like right when people are waking up, unfortunately, we've learned about technology today, people are looking at their phones. People are looking at their, their stuff. So maybe putting stuff at earlier in the day, they're more likely to see your stuff, or right after work. Maybe people haven't been on their phone all day, but they're getting right out of work and they're on their phones. So just a little tidbit if you're trying to get involved with the social medias. And another way we can network is via LinkedIn. This has been a big one for me lately. I never used it. We made one in college. They said you should make one. It's a good way to network. Never really thought about it. And then this year I got really involved because what else is there to do during the pandemic? So I found connecting with like individuals, whether it's things you might be interested in the future, maybe like a master's program, maybe looking at people who are professors or people who are in charge of that, connecting with them. Maybe you want to work with a different population, so connecting with people who do community outreach, who do mental health, who do long-term care. So it's a good way to network with people that maybe you wouldn't have networked otherwise. So that's awesome on LinkedIn. And also sharing of ideas. I'm also involved with like the Alzheimer's Association and different things in my personal life that you can also get involved in LinkedIn. So that's a good opportunity to get a part of if you haven't. There's also Facebook, Twitter, all of that stuff. I found that Instagram is probably one of the best resources because it's pictures, it's pretty user friendly. There's also, good old TikTok. So maybe if you're interested, if your facility is interested, talking to your marketing team. Another way is showing others in your community maybe what your specific department does. This is especially good for families because they can see with pictures or a blog or a newsletter that, oh, my loved one is participating or they are doing stuff. So that's just something else to think about. And another way to get involved or advocate is with professional organizations. So ATRA, American Therapeutic Recreation Association, is a great resource for us as recreation therapists. I actually just joined the marketing team because if you can't tell, I like to advocate for recreation therapy. So I decided to join that group and I hope to advocate professionally in the future. NYSTRA, New York State Therapeutic Recreation Association. There's also, depending on your state, there's different state memberships depending on your location. And the Alzheimer's Association, especially a lot of those of us that work in long-term care, this is a good resource, a good program to be a part of. So I kind of ran through this pretty fast, but we can have a discussion here. There's small ways and big ways to advocate for the profession. We just kind of skimmed the top, things that you can do every day in your life. Obviously, going bigger would be legislation or, getting approved for insurance reimbursement and that type of thing. But this is just things that all of us can do daily. Start with the basics, make it fun and enjoyable, and network to figure out what works best for you and your organization. So let's see what you guys were commenting earlier. That's also my contact information if you guys have any ideas or would like the PowerPoint. Let's see here. I just overheard coworkers talking about RT the one day. One said, "You don't need a degree to play games and dress like the Easter Bunny." No. People just don't know. I work at a day center for the elderly. Before COVID, I was seen as activities. Now with COVID, staff has seen how our participants have gone down in health a great deal because you're simply lack of stimulus. Yeah, see, with the whole COVID, they're realizing that it's a necessity. We use a Facebook page to post different events that the residents participate in. Since we cannot have volunteers coming to the long-term care unit, we can say thank you to our groups that provide food and donations that make the special events happen. Community and families can also see the residents are still active in what the recreation therapy team has going on. Yeah, exactly. Utilizing that social media as a resource. So does anybody have maybe ways they've advocated in their facility or maybe ideas that they might use in the future? Feel free to do the chat or you can unmute yourself if you want. I'm going to stop sharing this. Don't be shy.
I'll speak up, Abby.
Thank you.
Well, it's funny because like just yesterday, our physical therapist who I'm close with, so it wasn't as awkward as like emailing someone higher up in like administration, but she sent out the falls team agenda for our meeting yesterday, and in it said like recreation, describe what type of activities this resident participates in. And I just like shot her a quick email and I was like, hey, like for the future, instead of putting activities in there, can you please call it recreation therapy? I'd appreciate it. And she just emailed me back and she's like, oh, I didn't even realize I did it. Thanks for pointing it out. So I think it's just like, even like little things, as soon as you correct it, like people are going to be more likely to change the way they speak if you call them out on it. I learned from you not to be afraid of that.
Yeah. Thank you. Yeah. Just those simple little things can really, really change a person's perspective on, what recreation therapy is. Like we stated before, it's repetition. If you find that it's the same people that you're having issues with, or not issues, but questioning what you do, maybe simply sit them down and say, hey, this is what I did. Like somebody mentioned before, oh, you went to school to play? Yeah, here. Give them a, handout of everything that you did, all of the, the 4 years of education that you had, the price of the lovely certification test that we have to take. Hey, if you want to do it, you're more than welcome to, but we worked hard to get this certification, All right, anybody else? Thank you guys all for participating.
I just had a question. Where is your facility located?
My facility is located near Syracuse, New York.
Oh, okay. And what town is it in?
Auburn, New York.
Oh, okay.
Yeah. All right. Anybody else? Trying to think of another example that I've had. I've had plenty of interactions. I'm now part of the therapy team, not activities. For this first time, I was an RT doing one-on-ones in mental health. I took on many different roles and showed them I could do many things with their activities. This allowed me to move into therapy. I love that. That's another conversation at my facility to have too, is we're totally, I wouldn't say sectioned off, but we're totally in a different spot than the therapy gym. In the therapy gym, there's physical, OT, and speech, and recreation therapy kind of has their own kind of digs down here in the dungeon. But yeah, advocating for that and being able to show people what you utilize. I know at times, especially for entertainment and long-term care, we have the tendency to hire entertainment. So we hire people who are involved with music. We hire people who are, I don't know, have animals, do different things. When some of us have therapy dogs, why don't we bring our therapy dogs in and have a session with our therapy dog? I have a background in music, so lots of times I've done some of our music programs. Just make sure that you're not calling yourself a music therapist, because that's not our discipline, that's not our area of expertise, but you can utilize that as a modality. So might save you some money, and it might show you what your department is good at, utilizing them to their full potential and not just hiring outsourced people. Sorry guys, I talk fast. Is everybody okay? Government Cuomo had deemed, yes, that was the point that I was going to make, and I forgot to put it on my notes. Cuomo deeming recreation therapy as an essential service as one of the COVID-19 briefings. People probably were like, what is recreation therapy? And we're like, we're here. We're doing it. We've been here since the beginning. Right? So how is everybody going to advocate in their life?
Abby, I think you did a great job, and I think it sometimes feels really hard and uncomfortable to advocate for what we do. But I love what you talked about partnering up with marketing, because I think our marketing teams are already good at messaging, and they're already good at sharing the benefits of what happens within the walls of our facility or in our programs. So the more that we can get them on our side, I think is only to our benefit, because they can help message and share the value and the benefits. I work in assisted living primarily, and we can really talk about how our programming can actually influence people to move in. So there's actually a dollar value that can be put on it, because I know that can sometimes be hard in our profession, is that we're not necessarily a billed service, but it can be an encouraging factor to why people come to your program or to your agency or donate to your agency. So that, I think, is also a really valuable point when we're advocating for the work that we do, is that it's more than even just the programs we do. There's a bigger value to the organization as a whole.
Thank you, Jessica. I've your description of therapeutic recreation on all my emails I send out. That's great. Yeah, like I said, guys, it's from the smallest thing to the largest thing, whether it's just putting CTRS on your badge, addressing your emails with CTRS. I have a tendency at morning report, they'll say, we need to get licensure. I agree. What was I saying? Oh, at morning report, they'll say, what's going on in activities? I'll look around and I'll say, nothing from recreation. So just part of the culture change. It's happened in the past, and people are used to the same old day. They're not used to change. So being that voice of reason, being that voice of change, we're trying to make a difference here. Some people are job for a reason and is goal-driven, justice, PT, and OT. Worked in a hospital that refused to title us as recreation therapists, and instead we were activity therapists. Over the span of 5 years, I implemented an internship program, and whenever interns were with me, we would get the question of, oh, I didn't know there was a program for activities therapy in college. And that would open the conversation about recreation therapy. Woo! See? It opens conversation. That's what we like. And I think it's okay. I don't know if it's okay to be called by different names, because sometimes it depends on the mission statement of the facility. It depends on what their goals are, different things. But why can't we be called recreation therapists? That's what we went to school for. You don't call the doctor by some other name. They're a doctor. You don't call the PT by some other name. They're a PT. So we went to school for recreation therapy. Why can't you call me a recreation therapist? Maybe this is a conversation about job descriptions. Maybe this is a conversation about what we do. So, has anyone run across situations where you are not considered an LIP, therefore recreation programs do not qualify as evidence-based? Beth, what do you mean by LLP?
An LIP is a licensed independent provider.
Licensed independent provider. Gotcha.
Yeah, so what happens, at least in the mental health field, is even though I do many programs, we
Mhm.
have to meet a mandate of 4 to 6 programs run by licensed independent providers per day to meet the standards by the government.
Mhm.
So, it bothers me because I know I can go out in the community and be an independent provider, but because I think it has to do with not being a billable service.
Ah, gotcha. Gotcha. Yeah, see, it starts from the bottom, and like Dan said earlier, we need to get licensure, but it starts small, but we need like a snowball effect.
I have been on the licensure committee with the New York State Therapeutic Recreation Association, NYSTRA.
Yep.
Yeah, NYSTRA. I'm not sure where that's standing right now. I know it went so far to Congress, and I'm not sure if it's a bill, if it's still waiting. It's been a long process of trying to become licensed. That was when I was on that committee. I'd probably want to go back 8-10 years.
Yeah. What do we put? But I'm not sure if you're looking at the comments, but Dan's saying some stuff about quality health professional. Remember to use NCTC marketing materials. Yes, that is a great resource, Susan. Thank you for that.
Now let's see what he's saying.
He said, thought it was under qualified health professional. Might put us on the same platform as social workers with mental health.
To that, I haven't seen anything like that. I know social workers are LIPs. There's like the doctors are LIPs, social workers are LIPs, mental health, I don't know the term providers, outpatient mental health providers. It's a similar field of study to social work. They're LIPs.
Okay.
So, I keep trying. I have tried.
Fight the
I keep
fight,
working at it. I keep working at
it. Yeah. Well, I know that in mental health, like I said, the qualified health provider title, like I was able to run clinical groups in mental health, in a PROS program. So under the guidance of a licensed social worker, LCSW. So I did build as individual counseling and psychotherapy kind of a thing, and for individuals and groups. So there's that could be one of the areas where maybe they're ahead of the ball, or maybe that could be an avenue where we can get in more independent licensure. So.
I really think we need to do that. I work closely with my social workers every day, and in order for us to become basically LIPs, we got to come off of the bed service and be able to bring in money on our own. That's pretty much, because I'm doing groups all day long. Don't get me wrong. It's just my groups don't qualify under this evidence-based, even though they are evidence-based groups.
Yep.
And even though recreation therapy is an evidence-based profession, we are not seen by the powers that be as qualified or whatever. We're not seen. I don't want to use the word qualified because that's not correct. And I really think it has to do all with the funding. So until we're able to bring our own funding in, and maybe that's licensure, I'm not sure, because we're not doing that right now. I don't know. Is any organizations out there Are you guys all bed service, or is anybody bringing in money?
I can tell you for us, we're bed service. We're not bringing in any money in our long-term care facility right now. I'm not sure about anybody else here.
I mean, we are bringing in money, and in essence, I don't want to miscommunicate that. It's just,
Yeah.
it's not a billable service.
I
That's
get what you're
I-
saying. By insurance, I get what you're saying.
Right. Yeah.
Yeah. Okay. Well, it's a struggle, and we all need to really work on it and advocate. I
Yeah.
also think we need to advocate outside of our facilities. There's too many people who do not know who we are. You don't see us at the fairs. You don't see us, at different events where you see PT, you see OT, you see nursing,
Exactly.
you see speech, but you don't see recreation therapy out there. And
Yep.
we need to be out there so the public
That's
knows who we are,
Yeah.
or else they're going to think it, like many of them do, that we're activity professionals. And there's nothing wrong with activity professionals. But until we get out there and, explain to the general public what the difference is.
That's right. That's right.
Yeah,
We gotta
and
keep-
in long-term care, we have to do MDSs, but we're just
Yep,
not
we do.
bringing in all that money.
Yeah, right, yeah. Yeah, but we do the MDSs, we do the functional independent measures, we do all of those things.
Right.
Mhm.
Yeah, but,
Yeah. Yeah. So-
okay, that's enough of me.
That's okay. Thank you. Thank you. I appreciate it.
Thank you.
Yeah.
Mhm.
Are there any last minute questions?
Does anybody know where the licensure stands necessarily? Where we stand with licensure necessary? Is there another bill in the New York State Assembly and House? House and Senate, do you know? Does anybody know? No.
I would say
currently do not.
probably try to contact NYSTRA,
Yeah, I
the
know.
NYSTRA
I
organization.
know.
Yeah.
Yeah. Yeah.
I just wanted to say, as part of an advocacy, NCTRC have a board of directors program that actually the board of directors do attend conferences outside of therapeutic recreation as an advocacy piece. Obviously, right now that's a little bit on a standstill because
Sure.
we are sitting here virtually together at conferences right now. But that is something that we'll probably we will proceed with in the future when we are able. But it has been a nice opportunity to really get out there and share who we are, what we do, the benefits of providing recreational therapy services.
Yeah. I would be part of that group. Yeah, I would be part of that. Sure.
You can run for the NCTRC board of directors.
That sounds like a big job.
I'll have to look into it, Susan.
Look into that. There you go. There you go.
Oh,
Thank you.
darn it. Even though I'm almost to the end of my career, and I've got a couple of years left. But anyway, I wouldn't mind being part of that because I think licensure is so important to our field. I really think we need to go there, and we've tried for years. I just believe it's so important. So if you want my help, I'm on board.
Go Beth, go.
Yeah,
Yeah.
like I said, that would be with the state level organization. That I think the
Yeah.
NYSTRA is probably the organization to contact for that.
No, yes. I know, and they talked about it. I know.
Yes,
a long time
absolutely.
That was a big thing with Vincent Bonides and everything. It was
Yes.
big, but I know.
All right, everybody.
All right.
You can still contact Vincent. He's
I know.
not on that. He's not on the board anymore, and he's pretty high up. But he's always willing to talk about it. So if someone wants to go ahead and reach out, you can always find me at the VA. So I'd be willing to be a part of it.
Yeah,